my time to you. No. I think that is the most wonderful introduction I have ever heard.
Yes.
Thank you very, very much.
And Lee, we have your handouts. Do you want them to pass out now?
Yes. Or maybe, yeah, go ahead. Because I'm not going to refer to them right away, but I'll let you know when you have to look at them. The one thing that Susan left out is what one of the other qualifications I have in talking to you is my age. I've been around so long that I can give you a historical context for all you're doing. And I'm really excited to be talking to people who are doing what you are doing. I haven't been here for the whole 2 days, but I've been here enough to know that what you're doing is absolutely thrilling, and secondly, that the people assembled here seem to have the skills and talents and passion to do it. So that's a pretty exciting group of people to be meeting with. Now, in this historical context, I want to start with a long time ago in a galaxy far away. We used to think that once we could show some pilot intervention worked to improve outcomes, it would spread of its own accord. It would sow the seeds of its own replication. And I was lucky enough to come into government in the 1960s during a brief age of really innocence, when a compelling vision and good intentions and some anecdotes were good enough to warrant funding from a foundation or even from some brave public agencies, with the expectation that this innovation would soon be picked up by government and scaled up to reach all who might benefit. It took a while to learn that this was not going to be so, and that the theory of change that stipulated an automatic progression from pilots to policy had to be abandoned. One piece of evidence that I experienced was that within our reach, I profiled about 25 programs that had been successful in changing outcomes for kids and families. And 5 years later, those programs had either been dismembered or diluted, or they had disappeared. So that seemed very strange to me, since those programs, through my writing and others, had gotten a lot of publicity to say, yeah, this works. And that apparently wasn't enough. So by the time the 21st century rolled around, that naive theory of change was replaced. And it wasn't going to be good enough to cite a few encouraging stories to make a plausible case that your intervention was successful. You needed proof. You needed incontrovertible experimental documentation that proved that the intervention worked. And when Peter Orszag came to take over the Office of Management and Budget at the beginning of the Obama administration, he explained that the one guarantee against funding what doesn't work is experimental proof. His formulation, if you will forgive me, was that only randomized trials are bullshit resistant. And once you have that kind of clear proof, the new theory held, you could scale up proven programs, risk-free. Jeff Braddock of the Bridgespan Group says, today there may be no idea with greater currency in the social sector than scaling what works. Federal agencies such as the Social Innovation Fund and I3 and Department of Education, many large foundations too, have been giving funding preference to programmatic interventions that could offer experimental proof of improved results. And the good news was that having this experimental proof was often sufficiently persuasive to policymakers that it actually translated into significant resources. I think the best example of this is the Nurse-Family Partnership. As most of you know, NFP fields nurses to make home visits to low-income pregnant women pregnant with their first child. And it tested its original model in 3 randomized trials beginning 34 years ago with good, if modest, results, especially in prolonging the interval between first and second births. And NFP, as a result of these 3 randomized trials, is widely considered the most rigorously proven early childhood intervention. And most observers agree that it was because of these RCTs that the early versions of the Affordable Care Act allocated $1.5 million to NFP to operate its programs throughout the country. Now, by the time the act was passed, other home visiting programs had made their case for sharing some of those funds. But it's not far-fetched to believe that without NFP's randomized trials, the Affordable Care Act might never have included home visiting. In the last few years, there's also been increasing recognition that even a proven program is more likely to thrive when an individual or agency champions its spread. So we have seen support, especially from foundations with Edna McConnell Clark in the lead, for building organizational capacity and providing technical assistance to encourage implementation of proven programs. NFP again serves as an example, with Edna McConnell Clark investing heavily in its dissemination, which allowed it to double its reach in a single decade. So we have an evolving theory of change, starting with the model program that looks promising. The model spreads to improved outcomes. Didn't work. Then we have the model program with experimental proof of impact, and the model is supposed to spread and improve outcomes, and it didn't quite work. And then we get to the model program with the experimental proof of impact, and now with organizational capacity, and that is what is supposed to spread the model and improve outcomes. But even that new and improved theory of change still turns out to have a lot of limitations. First, interventions, even when based on proven models, don't always work in the real world the way the original model worked, something that every one of you has already experienced. We often don't know the critical ingredients of the model that accounts for its success. Third, we often don't know the elements of the political, funding, and demographic context that are essential to the success of the model. Where these are known, we may not have the necessary influence to change the context to make it hospitable to the intervention. Fourth, not every promising intervention can be assessed in ways that provide experimental proof of impact. Interventions that are particularly hard to assess with experimental methods tend to be complex, multi-layered, interactive, have to be adapted to a wide variety of cultures and populations, require reform of institutions, policies, and systems, are continually evolving in response to changes in context and in response to lessons learned and advances in knowledge. They aspire to change not just the outcomes of individual program participants, but to changing community conditions and community norms. And they unite the work of many people, organizations, and systems to achieve collective impact on shared goals. And perhaps most important in the list of limitations of our past ways of trying to assess what works is that our earlier approaches to knowledge building have neglected the question of what it would take to achieve and sustain improved programs at a far greater magnitude. To pursue the home visiting example for a moment, communities aiming for greater impact from their home visiting programs would supplement what has been proven in the past by acting on the research that, for instance, comes out of the Harvard Center on the Developing Child that showed that parents involved with substance abuse and postpartum depression were the 2 most common precipitants of toxic stress to children. They would build on and adapt past successes by enlisting partners that have worked successfully with substance abusing and depressed parents. They would draw on other evidence to add capacity to deal with violence and certainly to prevent homelessness. Given the research that we now have, you would want to add all of those things. You would even want to add home visiting or something like it to providers of family, friend, and neighbor care, because that's where some 40% of low-income children under age 5 with employed mothers get their out-of-home care. So states and communities that are now designing their home visiting programs would do all of this, would add all of this, if they didn't feel pressured to implement a proven program with fidelity to the original. I keep hearing from people who say, you know, you're not telling us anything new. We know that housing is a big issue. It's just that we can get money to implement a home visiting program that has been proven, and we haven't yet proven that housing makes the difference. But we know that housing makes the difference. So why not let people try to add those parts and still consider them as respectable implementers based on evidence? It's just not the evidence of a proven program. So I don't want to criticize home visiting programs, especially not NFP and its founder David Olds, who's done so much to put home visiting on the national agenda and is constantly working to refine his model. My criticism is aimed at the funders and policymakers who seek to minimize risk by making it hard for ground level people to build on, adapt, and improve on proven models. And thankfully, that does not include the funders that have initiated your work. They know that we need to put a lot of stuff together that has not yet been proven in combination. So that's what you're trying to do. I believe that in addition to the proof that might come out of the national evaluation, your local evaluations will add a lot of additional information. And here's when I want you to look at the chart that has been distributed at your tables. I don't want you to read it now. It's not up here because there are too many words on it. But what I want you to look at is that the first row, the light-colored row, which is where we've spent most of our evaluation energy to establish accountability and to figure out what interventions should be implemented or scaled up, where we ask what has worked, what's the impact of specific interventions, and in order to do that, we use both experimental evaluations, and now we're coming to use more multiple methods to assess complex and evolving interventions aimed at broader populations. That is where our evaluation energy has flowed. You are in a position, and I was pleased to hear this morning that the national evaluators are also trying to get below that line to look at not just is it working, but if it's working, how and why. And I think you'll have a greater chance of getting at those questions in your local evaluations, but to be combining the work of the national evaluation and local evaluations to ask, how do we build on and adapt what works, and what do we need to know to design and implement more effective interventions than we've been able to do in the past. So I think that in this context, the people in this room
broad evaluation of a highly complex intervention with many moving parts. There are three aspects of this that I think are going to be particularly challenging. First, finding ways to understand the work of many contributors whose efforts have to interact to be most effective. You can't just do it piecemeal. You can't, not only can you not provide services piecemeal, you can't evaluate piecemeal because you will miss the magic of the sum being larger than its parts. A second challenging aspect will be finding ways of documenting interventions that will not remain constant, but are in fact encouraged to evolve in response to lessons learned. Perhaps most difficult, given the pressures on you to show quick results, it will be hard to take into account the advice of the evaluation guru, Donald Campbell, who said, never evaluate an initiative until after it has become proud. So that's going to be a tough one, the timing. Second, in my list of why you have this unique opportunity is you're encouraged and supported, even required, to engage in real-time learning at many levels and in many dimensions. Because the public-private partnership that developed this very imaginative initiative consisted of an unusually sophisticated group of philanthropists and public servants, you'll be answering much deeper questions than does it work. And that, I think, that the idea of being systematic beyond the does it work question is a major breakthrough. You're asked to do what it takes to understand what's really happening on the ground in work that is not just complex, but messy, far too messy to be understood with the tools we used in an earlier day. You won't be constrained by the prevailing mindset that FSG's John Kenya describes as virtually requiring that complex problems be distilled into simplified schema so that funders can select and describe their specific points of intervention, even when that perspective no longer fits the realities of social change. You'll be able to answer the kinds of questions that will allow this pioneering combination of interventions to come out of the pilot stage with precisely the knowledge that will be needed to sustain this initiative and prevent it from going down in history as a boutique flash in the pan. Sorry about the mixed metaphor. Because of the assumptions on which your intervention rests and because of the learning you're doing and will be doing, yours will not be a pilot program that ultimately disappeared, nor will this be a model which in the course of scale-up was willy-nilly dismembered into a few component parts that were easier to implement and to evaluate at the cost of significant impact. In your efforts to learn how and why what's working is working, you'll be including, not excluding, such hard to quantify but crucial aspects of your work as engagement and trusting relationships. You'll be able to plan your interventions with the knowledge that families have varied needs and are the best source of expertise and insights on what will make a difference for them. No one will ask you to ignore those truths, even when that makes the counting harder and compromises the ability to mimic the controlled lab conditions that so many evaluators and policymakers yearn for. You have the good fortune that all of your sites are aiming to achieve similar goals, ranging from stable housing, greater safety and well-being, and more parental employment in some cases, to less child treatment and less involvement with the child welfare system. The similarities in your goals will facilitate your learning from each other's discoveries and even from your occasional disappointments. You have the makings of precisely the kind of network that will, to quote John Kenya again, accelerate collective knowledge sharing and problem solving. With some special efforts in collaboration in collaboration with the national evaluators, you'll be able to extract the critical common ingredients of effective practices and strategies, which often turn out to be a better guide to action than our model programs. These critical common ingredients may be programmatic, they may involve implementation, or they may involve contextual conditions. They can extend evidence-based practice beyond brand name models. They can be applied to the design of new interventions and can strengthen existing interventions when they adopt more of the elements that have been identified as accounting for success. You're building on the new awareness that effective implementation is not a matter of holding every aspect of your interventions constant. Rather, you're monitoring and evaluating your performance routinely and improving it continuously. Even the best initiatives are improved by the continuous development, testing, and refinement of new strategies to produce stronger outcomes. Your work is also destined to achieve breakthrough outcomes because you are not confined to silos, not in your data collection, your reporting requirements, or your practice. In a recent article in the Stanford Social Innovations Review, my friend and colleague Katja Fell-Smith writes about her work with homeless women in Boston. She quickly discovered that most had long histories of domestic violence and childhood abuse. But when they tried to get help, they had to declare whether they were homeless or a trauma survivor. It had to be one or the other because programs and systems weren't set up to provide more than one narrowly designed service. The options available weren't appropriate for the women who were most in need of help. Your work is changing that, not only at your 5 sites. We can expect the influence of your work to ultimately make silos permeable well beyond these 5 sites. As Commissioner Chang said, neither parents nor children come in pieces, and you're allowed to act on that insight. So your work is showing that we can aim high, that we need not confine ourselves to spreading the interventions that were proven successful in the past. Given the enormous advances of the last several decades in science, in our understanding of human behavior, in our insights into the institutional obstacles that can prevent real change, we can aim for ambitious, transformative change. We can aim to reduce homelessness and increase child well-being in each of your sites and more. The interventions you are in the process of designing and adapting and improving and documenting will ultimately help to show the way to reducing widespread racial, income, and geographic disparities in health, in education, in child welfare, in justice, and employment throughout the nation. And I wish you well in this very challenging and noble work you're engaged in.
Thank you.